think what makes Johnson County Community College unique is the camaraderie that you build, not only with your fellow students, but also with the instructors.
As a lab instructor, I feel strongly about being able to teach the students the proper techniques and love of the field.
Everybody's been really good to me, and they really let me get in there and do hands-on and everything.
My name is Marissa Webster, and I'm a paramedic. I'm a lab instructor for Johnson County Community College MICT program. MICT stands for Mobile Intensive Care Technician. I think a lot of the experience here that the students need to get has to do with bedside manner and talking to people. My favorite part of the business is actually the hand-holding and the talking to the patients. You learn so much about yourself, about other people, about life through taking care of these people. I mean, you basically get to live vicariously through them, and you get to see all kinds of situations that are different from yours. And so it's really that connection with the human being. That is why I love to do what I do.
My name is Bob Parker. I'm an emergency medical science professor here at Johnson County Community College and also a paramedic in the state of Kansas. The EMS department here at Johnson County is responsible for teaching all levels of emergency medical science education. We teach first responders, usually police officers, sometimes firefighters, security guards, anybody who might come in contact with the public and need to render aid. Emergency medical technician is the next level of course that we teach. EMTs are the basic level of certification required for ambulances or for fire truck operation. The paramedic student, on the other hand, has a much broader scope of practice. They administer medications out in the field. They use advanced airway techniques, EKG interpretation. They can administer defibrillation or other electrical therapies in the field. The paramedic program here at Johnson County Community College runs about 2,100 hours. It's a one-year program, and it's broken up into 4 sections. The first 2 sections are primarily classroom time, and then the last 2 sections are clinical time, and then our field time is done on the ambulances with experienced crews. In the simulations that we've been running this week, students are dispatched in the ambulance. They respond to the call.
Abdominal pain and room 271 at the Rainier Center.
They figure out how to access the patient, the best way to get into the patient. While they're going into the call, they're also looking for how am I going to get this patient back out. They gain access to the patient. They assess the patient thoroughly, take histories, do physical assessments.
I take Lipitor.
They decide on a treatment plan, treat the patient, prepare them for transport.
We're going to try to get you to the hospital so you can get some really good care.
Move them to the ambulance, drive them to the hospital while they continue treatments, and then move them into our simulated emergency department over in the nursing lab, where they hand off care to nurses in our simulated emergency room.
It feels like somebody's ripping me in two.
Okay. How long has this been going on?
10 minutes.
10 minutes. Okay.
After that, they do a complete debrief and get feedback from their instructors on how they did with the call. That gives everybody an opportunity to learn the other things that maybe should have gone on the call, how could we have done things differently, and improve for their performance next time.
I think the debriefing is really important, and I'm glad that it's available because I know in other programs it's not. I mean, they just kind of, here's a mannequin, do your thing, here's your grade. Here at Johnson County Community College, we sit down for 15-20 minutes after the call and discuss every aspect of it. It's nice to have that time for the feedback and the talk.
The review really helps because if there's something that you're continually leaving out, the debriefing at the end really helps to point it out. Hey, you're forgetting to do this each time, or you did great on it, you just forgot this one minor detail.
I thought you did a good job with your initial assessment, initial history gathering, all that good stuff.
And we like to make the debriefings a very safe environment where they can feel relaxed and not feel like, well, this is what you did wrong, that sort of thing. We have a form that we use every time. It's the same one. Basically, it has all the points that they are supposed to hit. And so, for instance, we can see how long it took them to get to the call. We can see how long it took them to get patient contact, or to get the IV in, or how long it took them to get oxygen on the patient, how long they were on the scene for, and how long it took them to transport to the ER. I typically turn the paperwork over actually and write a lot of little notes of things that aren't necessarily graded on, but they're good learning points or teaching points or things that may not be involved in the scenario, but we want them to know that they do happen in real life and things that it's good to review or look at or keep in mind.
The camaraderie that you build, not only with your fellow students, but also with the instructors, it's very helpful. It's an important part of your schooling because we're here all the time. It's an intense program that demands a lot of commitment from you. And it's nice to be able to have instructors that you can bounce ideas off of or concerns. You can go to your instructor, you have that camaraderie built with your instructors that you can feel free to talk to them about anything.
It's more of a non-judgmental environment here, which helps. It's a safe environment and people are saying, okay, well, you're still in the process of learning and putting everything together.
It's a safe place, it's a place where everyone's talking, nobody's judging or accusing, but just really an open dialogue on how you can improve your skills.
Most of the time, they see what they did wrong and we don't even have to tell them because they work it out themselves.
It's a job interview from day one. I mean, our lab instructors are working paramedics. One of the instructors that we have here was on the hiring committee for MEDAC.
As a lab instructor, I feel strongly about being able to teach the students the proper techniques and love of the field. I like to be here for them as an advocate. I enjoy working with them. This is probably one of my favorite things that I do. This is also somewhat of my hobby.
The staff here has been wonderful, very helpful. They're very approachable, which you don't always have that. I know I'm getting a great education. Just talking to other people in the community and finding out, oh, you're going to Johnson County Community College paramedic program. They hold that in high regards as well. My clinical experience has been wonderful. Everybody's been really, really good to me, and they really let me get in there and do hands-on and everything.
I'm gonna put this mask on you, okay?
The EMS department standards here at Johnson County Community College are pretty high. I mean, we get out of school and you're sought after because of the level of education that we get here. The networking that you get out of this program is also, I think, is superior to probably many other programs. You want to use this time to really try and build relationships and network and get out and do the job.
Simulation in EMS education gives the student an opportunity to experience types of problems that are relatively low frequency. They don't happen very often, but they're extremely high risk to the patient. We can simulate all that in high fidelity simulation.
It really helps because it's more like real life. When we're just in the classroom doing the same thing over and over, you don't think about things like bystanders or the person across the street with a knife that's coming at you. When we go out into the field, you don't quite know the environment as much as you do the classroom, and so you really have to think and pay attention.
Most things can be simulated, but there are certain things that cannot be simulated, and I'm basically there to verbalize those things. I'm also there for grading purposes. I'm also there to do the team debriefings after the simulation is run, as well as oversee the safety for everybody involved, because there's a lot of folks who we encounter, obviously, who don't know what's going on at that time. So just make sure that they're safe, that the team members are safe, and that the lab instructors are safe as well.
You're gonna go to the conference room?
The manpower that goes into simulation is enormous. Simulation is a very labor-intensive process just in the preparation of getting everything ready for the calls, and then in debriefing the calls and setting up for the next one. There's a lot of behind-the-scenes people that have been involved in this.
The thing that I'm noticing is they're having me move. They're not thinking about how to get me from where I'm at to the cot without me doing the movement.
We've been using 5 part-time faculty every day, plus 3 full-time faculty have been involved in this every day. Very labor-intensive process, but it reaped great rewards for us.
I highly recommend it to anybody who's considering to come through this program versus another program.
I think it was like the first week of class, Denny Kurogi, who was the old dean of the program, came in and he looked, just told us all in the class, he said, listen, you're in the Harvard of paramedic programs, so don't mess it up. And that stuck with me throughout the year. I mean, he's right. It's a great program.